Hello friends, I am Animesh Williams, Cluster Coordinator for Wheelchair Access Project at Kanpur. I want to share some of the success of this project which has been implemented in this area last year. Just I want to say, we did the wheelchair provision in Kanpur area program last year, and around 57 wheelchairs were given to the clients with locomotor disability. Apart from this, I want to share, since it's 8 months have already passed, the wheelchair has been given to the clients. Now the mobility part of the client has been increased. We have visited the community and find many clients that now they are very happy, and a lot of clients have started working somewhere else for their livelihood. This is a good sign regarding the wheelchairs which we provided. Another thing which I want to share is the stakeholders. These stakeholders which are associated with World Wheelchair Access Project are from the different organizations and government officials also. These stakeholders are oriented on WHO 8 steps, and what I would like to say is that these stakeholders are having a good understanding on the 8 steps of wheelchair provision, and apart from this, we can just see few of the video clippings which the stakeholders have shared in their views, their thoughts they have expressed in the coming videos. Thank you.
Hi, I am N.T. Murthy, Program Manager, Project of World Vision India. I'm really happy to share about the wheelchair program, and through this program we have identified 57 clients from various communities we are working, and these people were identified and finalized after a thorough process of assessments, screening. As per the WHO standard, these access wheelchairs were provided, and these people are very happily using it. And the main purpose of providing these wheelchairs to create the better access and help them to mainstream. And through this access project, we have also formed 15 CVA groups where these people gather once in a month and they discuss about various facilities and also the entitlements about the development of the physically challenged people. And also we have also formed the district level NGO forum, and the CVA groups, NGO forums. These people, they come together once in a month and they discuss, and these NGO forum also taking active role to support these people. That is really very interesting. And these wheelchairs are really very costly and very high-tech wheelchairs, but we provided to the poorest of the poor people, and we believe that in the days to come, these wheelchairs will really enable their lives to lead a better life. And World Vision Kanpur Urban IDP program is also trying to help these people for their livelihoods. We believe that with this livelihood support also enable these people to lead a better life. And especially this program in Uttar Pradesh and Uttarakhand is really created a great impact in the entire states. We really acknowledge all our international partners for joining their hands for this cause. Thank you.
I'm Meena Narona, the Director of Spastic Center, Kanpur, now called Ashayan. We are working in the field of rehabilitation for the last 25 years. And in the last few years, we have been associated with World Vision in the India Access Project. We are the stakeholders over there, and they are doing very good work because many of our children are wheelchair users. As of now, we were using wheelchairs from Alamco, but it was not adapted to each child. Now, with the Access Project and Mobility India, each wheelchair is adapted to the child's needs, which makes for very effective mobility. In Kanpur, there are around 57 clients were assisted with appropriate wheelchairs. Wheelchairs is a means of empowering the disabled, the people with disability to get employment and to be able to become more independent. This is one of the main tools for rehabilitation. I wish Access Project and World Vision all the best, and I hope that their wheelchair project will also influence the government agencies like Aramco to improve their wheelchairs, and so our children get the best of it. Our center has been working in this field for the last 25 years, that is from 1990. We work with children. We were basically started for cerebral palsy, but now we have children with mental retardation, Down syndrome, multiply handicapped and autistic children. We also train our children through NIOS, that is National Institute of Open Schooling, and we have good success with children with cerebral palsy who can go up to post-graduation level. We try to get our children employment so that they become economically independent also. The children who are not able to study are given training in weaving, in block printing, in packing, in paper bag making, which will give them skills to work in any other place so that they can earn a little to survive. We have survival cooking is a very important aspect of our training. Every child learns to cook for themselves so that whenever they are alone, they can survive. Other than that, we take our children on outings for picnics, for exposure visits to malls, for movies, to parks, so that our children can adapt easily into society.
Hello, I am A.K. Srivastava, ex-DGM Alimco. I had been associated with Access program of World Vision, and since beginning I found that we are doing a lot of improvement in the wheelchairs to follow this WHO 8-step guidelines. In fact, this is the one serious improvement which is required by WHO for the betterment of wheelchair users. By using this wheelchair, now the wheelchair users are more self-reliant and they find it more independent in use of this wheelchair. As a stakeholder, I extend my support to this Access program. So far, we were using one type of wheelchair which at times were not suitable for a specific requirement of the individual patients. For this WHO introduced this 8-step guidelines to have this tailor-made concept for each wheelchair. So I found that utilizing this particular feature, the Alimco also started collaborating with of different wheelchair manufacturers, and they have also started a new type of products having this concept. World Vision has already taken lead in this through Access program, and now these stakeholders, the user, the donor, all they are particular about this type of wheelchairs which care for individual requirement of individual disabled person. I feel that this is going to create a good sort of improvement and certainly going to help the disabled at large. The beginning at UP and Uttarakhand has already taken place, and it has substantially made the dent on the disabled population of these two states. I wish the program is extended to other states of the country and the entire country gets the benefits of this program. Thank you.
Hello, I am Ganesh Pandey and I am convener of a community development organization based in Kanpur, Uttar Pradesh, named as Shramik Bharati. I have had the privilege of associating with World Vision in some of their programs. Recently, I had the opportunity to be associated with their work in the area of disability. They have been providing quality wheelchair to disabled people from many of the slum communities of Kanpur city. I had the opportunity to participate in a program in which such wheelchairs were given to disabled people. I was very happy to see the quality of these wheelchairs. I was very happy to see that all the stipulations of WHO are being followed, and I could also witness the happiness on the faces of recipients. Such a simple thing like a wheelchair, the provision of wheelchair can make a tremendous difference in the quality of life of individual people. I have seen them becoming more independent, becoming more mobile, becoming more active and self-confident. I want to congratulate to World Vision for remarkably good work that they have been doing in the area of disability. And in particular, their provision of this wheelchair has been a solid step towards bringing disabled people into the mainstream. I thank you very much.
I am Vishal Yadav, CRC Coordinator of Cluster Resource Center, Premnagar. My cluster is working for children's. Our department is run by Uttar Pradesh Basic Shiksha Parishad. I am partner of SS project of World Vision, which is working for disabled peoples, especially crippled people which are not able to walk. The wheelchairs which are provided by World Vision to disabled people are very good, which was made as a World Health Organization 8-step, and this is very useful for all crippled persons. I want these wheelchairs are distributed not in Kanpur but they are distributed in all over India. Thank you.